At the very inception of our video, once again, I'd like to invite you to this lesson on dementia. Now we are going to enjoy a nice reading on dementia, especially prevention of dementia from Wikipedia, the free encyclopedia. Before going to enjoy this lesson, I'd like to tell you that risk factors, dental health, and diet are the ways of prevention of dementia. In our previous classes, we have already enjoyed the reading on risk factors as a way of prevention to dementia. And now, in this class, I'd like to read some lessons from dementia on dental health and diet. Dental health and diet as a way of prevention to dementia. Now, let's start the reading. Prevention, main article, prevention of dementia. This is a part of the main article, prevention of dementia. You should also see neuroplastic effect of pollution as the risk factors. Okay, this is our main reading. Dental health as a way of prevention to dementia. Limited evidence links poor oral health to cognitive decline. However, failure to perform tooth brushing and gingival inflammation can be used as dementia risk predictors. Oral bacteria. The link between Alzheimer's and gum disease is oral bacteria. In the oral cavity, bacterial species include P. gingivalis, F. nucleatum, P. intermedia, and T. forsythia. 6 oral treponema Spirochetes have been examined in the brains of Alzheimer's patients. Spirochetes are neurotropic in nature, meaning they act to destroy nerve tissue and create inflammation. Inflammatory pathogens are an indicator of Alzheimer's disease, and bacteria related to gum disease have been found in the brains of Alzheimer's disease sufferers. The bacteria invade nerve tissue in the brain, increasing the permeability of the blood-brain barrier and promoting the onset of Alzheimer's. Individuals with a plethora of tooth plaque risk cognitive decline. Poor oral hygiene can have an adverse effect on speech and nutrition, causing general and cognitive health decline. Oral viruses. Herpes simplex virus, HSV, has been found in more than 70% of those aged over 50. HSV persists in the peripheral nervous system and can be triggered by stress, illness, or fatigue. High proportions of viral-associated proteins in amyloid plaques or neurofibrillary tangles (NFTs) confirm the involvement of HSV, herpes simplex virus 1, in Alzheimer's disease pathology. NFTs, neurofibrillary tangles, are known as the primary marker of Alzheimer's disease. HSV1, herpes simplex virus 1, produces the main components on NFTs or neurofibrillary tangles. Diet. Diet is seen to be a modifiable risk factor for the development of dementia. Thiamine dementia deficiency is identified to increase the risk of Alzheimer's disease in adults. The role of thiamine in brain physiology is unique and is essential for the normal cognitive function of older people. Many dietary choices of the elderly population, including the higher intake of gluten-free products, compromise the intake of thiamine, as these products are not fortified with thiamine. The Mediterranean and DASH diets are both associated with less cognitive decline. A different approach has been to incorporate elements of both of these diets into one as the MIND diet or MIND diet. These diets are generally low in saturated fats while providing a good source of carbohydrates. mainly those that help stabilize blood sugar and insulin levels. Raised blood sugar levels over a long time can damage nerves and cause memory problems if they are not managed. Nutritional factors associated with the proposed diets for reducing dementia risks include unsaturated fatty acids, antioxidants, vitamin E, vitamin C, and flavonoids, vitamin B, and vitamin D. The MIND diet may be more protective, but further studies are needed. The Mediterranean diet seems to be more protective against Alzheimer's than DASH, but there are no consistent findings against dementia in general. The role of olive oil needs further study, as it may be one of the most important components in reducing the risks of cognitive decline and dementia. In those with celiac disease or non-celiac gluten sensitivity, a strict gluten-free diet may relieve the symptoms given a mild cognitive impairment. Once dementia is advanced, no evidence suggests that a gluten-free diet is useful. Omega-3 fatty acid Omega-3 fatty acid supplements do not appear to benefit or harm people with mild to moderate symptoms. However, there is good evidence that omega-3 incorporation into the diet is of benefit in treating depression, a common symptom and potentially modifiable risk factor for dementia. So I hope you have already enjoyed the reading on dementia, on the preventive measures, on dental health and diet. So I would like to tell you, I would always appreciate any of the trial, any of the endeavor, any of the attempts from you to be a part of this channel, and I'd like to thank you for the comments and criticisms, for the likes, and for the subscription you have done to the channel. Lastly, I'd like to congratulate you on listening to this nice reading, and thank you very much. Thank you once again for subscribing to this channel, and don't forget to subscribe to this channel. Please keep continuing subscribing to this channel if these videos are helpful to you, if these videos are beneficial for your English reading. I do hope you will tell and share these videos to your friends. Okay, thank you very much.